Let's go through the detailed process of gathering history and managing a patient with acute coronary syndrome (ACS). Presenting complaints. Chest pain. Explore it, ask about the duration, how long the pain has been present, any triggers, what brings it on, any trauma, was there any injury, and whether the pain is continuous or intermittent. Radiation. Determine if the pain travels to other areas, such as the arm, neck, jaw, or back. Other chest symptoms. Inquire about associated symptoms like cough, shortness of breath, SOB, and palpitations. It's important to explore these until you are sure there are no other symptoms. Closed questions, differentials, red flags. Sweating, vomiting, these symptoms can indicate a myocardial infarction, heart attack. Leg pain, swelling, recent travel, these could suggest a pulmonary embolism, a blood clot in the lungs. Fever, heartburn, rash, these symptoms can help rule out other conditions like infections or gastrointestinal issues. General questions. Past medical history. Ask about any previous heart or lung conditions. Medications. Check if the patient is taking any medications, especially NSAIDs, which can affect the heart. Family history. Inquire about any family history of cardiac issues. Lifestyle. Ask about smoking and alcohol use, as these are risk factors for heart disease. Impact on life. Understand how the symptoms are affecting the patient's daily life, work, and home environment. Concerns and expectations. Address any concerns the patient may have and understand their expectations from the consultation. Examination. Vitals. Check blood pressure, heart rate, and temperature. Chest and neck. Look for signs of heart failure, such as jugular venous distension or abnormal heart sounds. Abdomen. Check for any lumps or signs of an abdominal aortic aneurysm, AAA. ECG. Perform an electrocardiogram to look for signs of ACS. Explanation and management. ACS. Explain that ACS is a serious medical emergency where the blood supply to the heart is blocked, usually by a blood clot. Immediate investigations and possibly admission to the hospital is required. Investigations. Blood tests. Measure troponin levels twice to check for heart muscle damage, and CRP to look for inflammation. Imaging. Perform a chest X-ray to check for other causes of chest pain, an echocardiogram to assess heart function, and an angiogram to visualize the coronary arteries. Management. Admission. The patient may need to be admitted to the hospital. MONA. Administer morphine for pain relief, oxygen if needed, nitrates to dilate blood vessels, and aspirin to prevent further clotting. Further steps. STEMI. If the patient has a ST elevation myocardial infarction, they may need percutaneous coronary intervention, PCI, to widen the blocked vessel. STEMI. If the patient has a non-ST elevation myocardial infarction, they may need medications to thin the blood and an angiography to plan further treatment. Medications. Long-term medications may include aspirin, ACE inhibitors, and beta blockers to manage heart disease. Safety net. Follow-up. Arrange follow-up appointments to monitor the patient's progress. Lifestyle advice. Advise the patient to quit smoking, reduce alcohol intake, manage weight, increase fiber intake, reduce red meat consumption, and increase exercise. Educational materials. Provide leaflets with information on heart health and lifestyle changes. Final steps. Ask for ideas, understand the patient's perspective, and explain the condition in a way that makes sense to them. Incorporate IPS, individualized patient support, which involves tailoring the management plan to the patient's specific needs and circumstances. This comprehensive approach ensures that all aspects of the patient's condition are addressed, leading to a more accurate diagnosis and effective management plan. If you have any specific questions or need further clarification on any part, feel free to ask.